So if you were out in your yard and you stepped on a nail, would you want to know about it? Well, of course you would. So the question is, how do you know that you actually stepped on a nail? Now, unless you're looking down directly at the floor and using your eyes to see that the nail was there, how do you know you stepped on it? Let's say you're looking straight ahead, you're out in the yard working without shoes. Well, the answer lies in our nerves. Now, nerves detect and transmit signals throughout the entire body and lets our body and brain know what's going on. And they have a small level of electricity that's a normal baseline. Nerves are alive, so they have this electricity flowing to them, and they have sensors attached to them. So if you look at this picture here, this is a picture of someone actually stepping on a nail and what actually takes place in the body when that happens. So as soon as we step on the nail, the sensors attached to the nerve, the danger sensors, sends a signal. It increases its electricity. It sends a signal up through the nerves in the leg and into the spinal cord, and from there, from the spinal cord up into the brain. And that danger signal is transmitted through the nerves to the spinal cord up into the brain so the brain can decide what to do with that information. So the nerves in the foot and the leg that normally have a low level of electricity going through them, a low level of function, as soon as you step on that nail, suddenly increases its function. The danger signals wake up and send the signals directly up to the brain. So in other words, the alarm bells in your foot have gone off to let us know something is going on. And ultimately, the whole reason for the alarm bells going off, sending the signal up through the nerves into your brain, is so we could take action. Obviously, the first thing we do is pull our foot away out of the nail. We address any kind of wounds or bleeding that have taken place in the foot. Obviously, we're doing that to prevent infection, to prevent further damage. We may wrap the foot up, put a band-aid on it. But as you see here, over time, the nerves in the foot and the entire nervous system eventually gets better. Over time, days, weeks, months, you're able to walk fine again, whereas initially you may be limping, you may be in a lot of pain. But as the foot heals, the pain lessens and your function returns. Now, this same basic process of danger signals detecting actual or potential injury to the foot happens everywhere throughout the body. Anytime the body is in pain, this is what happens. So let's say in back pain, you bend over to pick something heavy, you suddenly stretch the back muscles, the danger alarm signals in the back goes off through the spinal cord and up to the brain. And what happens, no matter where the pain is, our nerves in the back and that whole pathway in the brain, everything stays extra sensitive. And that extra sensitivity state or stage is geared for protection. So we don't overuse the back. We rest the back a little bit and we let the tissues heal. So then over time, the back or the foot or the arm, as the tissues heal, the pain lessens and we go back to normal. We're able to bend normal. We're able to sit and stand and move and run normally like we did before the pain. And the nerves in the back and throughout the spinal cord and throughout the brain all go back to their normal electrical level of activity as they were before the pain. So now they're no longer sensitive. Now what the research has shown is approximately 1 in 4 people, this process of the nerves returning back to their normal electrical level actually never happens. The nerves never return to their baseline and the tissues stay extra sensitive. The nerves, the receptors, and that whole pathway from the nerves to the spinal cord and the brain stays extra sensitive. Now what that means is 3 months, 6 months, or 6 years after the injury, you still have little room for activities. You're still very sensitive to touch in that area. You still could only sit, stand, bend, or move for short periods of time without feeling a lot of pain, as almost if you still had the initial injury that happened when it first happened. your body is still responding in that way. The alarm bells are still going off and everything is still extra sensitive, and you're very far away from that normal baseline level when you could sit, stand, or move as long as you wanted to. So those nerves are sitting right below threshold, ready to sound with the slightest touch or movement. So the question is, why is the pain alarm bells still going off? Why are those nerves so sensitive, ready to fire and send danger signals with the slightest touch or the slightest movement or the slightest positioning 3 months, 6 months, or 6 years after an injury or after an episode of pain? And what the research has shown consistently is our thoughts, our cognitions, and our emotions can contribute to keeping the nerves in our back or leg, whatever area we injured, sensitive. The most common association between high levels of sensitivity in the nerves or ongoing persistent pain are things such as anxiety, depression, fear, thinking the worst outcome after an injury, any kind of excessive stress in your work or home life. As we could see in this graphic, if you had multiple treatments and they didn't work, that causes you anxiety and stress. Going to different doctors, getting different explanations. And what the research has shown is people that have chronic and ongoing pain, that 1 in 4 patient population, they most of the time will have a significant driver of their pain like we just talked about. In addition, there's lifestyle factors that could contribute to keeping the nerves in your back or leg or wherever you experience the pain sensitive, such as diet, a poor diet, inadequate sleep, and excessive overall stress. So the question is, how do we get back to where we were? How can we dampen those alarm bells or danger signals coming through the nerves and up to the brain? How do we influence the brain's output of pain? The good news is the brain has a remarkable ability to do this inherently. We have the ability to produce strong pain inhibiting chemicals. We all have heard of endorphins or enkephalins. If not, we've all heard of morphine and powerful opioid medications. The brain has the ability to produce compounds such as this to dampen those alarm bells or danger signals from the body. With proper stimulus and with proper guidance, we can turn on the brain's ability to do this and ultimately help to bring the nerves and the nervous system slowly back down its baseline level. And what that means for patients is being able to function better or do more with less pain or tolerate more touch with less pain. Now, there are many different options that we can employ and that we guide patients on regarding the brain's ability to help dampen those danger signals coming in from the body, which usually correlates to feeling less pain. So things like education about pain, what is going on, how patients can help themselves. Things such as relaxation therapy, meditation, and yoga, improving diet, improving sleep. These are all things that help the brain dampen and calm down signals, turn down the volume on those pain alarm bells that are coming in from the body, the danger signals, the alarms coming in from the body. But particularly as chiropractors and rehabilitation specialists, our expertise is movement and exercise. And movement and exercise are possibly the biggest painkillers on the planet. They are natural painkillers. And if we look at the slide here, a 6-mile run stimulates an endorphin release equivalent to 10 milligrams of morphine. Now, if you fractured a bone and went into the emergency room, they possibly give you 2 milligrams of morphine. And that's why we always hear things like runner's high or exercise becomes like an addiction. Well, it actually does become the case of an addiction because the chemicals you release are similar to chemicals that we get addicted to with certain substances. But it's naturally, we call endogenous, our body has the ability to make these chemicals. And helps to modulate pain naturally. The key is knowing how to turn on these pathways and how to stimulate the brain and nervous system's ability to do this naturally. And that's what our expertise is in. So we have to be exercising at a certain intensity for a certain duration to get this benefit of stimulating the nervous system and the brain's ability to release these opioid-like chemicals to dampen these alarm bells coming in from the body and throughout the nervous system. So part of the art of rehabilitation is finding an intensity and a duration for a patient that they'll be able to tolerate, kind of meeting them at the level that they're at and trying to bridge the gap of being at the level that they need to be. So how do we go about guiding patients on an exercise and rehabilitation regimen when just moving hurts, or light touch or light pressure hurts, bending hurt, sitting or standing for short times hurt? Well, the answer to that question lies in our understanding about pain neuroscience, the discussions that we're talking about right now. We have to understand that in persistent pain, the nerves are sitting right below a firing threshold and they're ready to send danger signals to the brain with little pressure or little movement. And we just have to understand that feeling pain with gentle pressure or gentle movement doesn't mean that anything is getting harmed or damaged. A common misperception, and understandably so, with chronic pain or persistent pain patients is, I'm in so much pain when I'm moving, I must be damaging something. But we just have to always go back to our understanding, knowing we're not damaging anything, just the nerves in those areas are extra sensitive. We have to reprogram those nerves and retrain the nervous system to slowly get back to their baseline firing. So hurt does not equal harm. We are sore, but we're safe. These are concepts that we have to repeat to ourselves and to our patients, particularly in chronic pain. In acute pain, hurt may equal harm because the tissues have to heal. But in chronic persistent pain, that is not the case. So there has to be a balance. We know that exercise and pain is beneficial. We have to exercise with a little bit of pain because that will stimulate the body to relax. And we slowly, by going into that pain and nudging it and teasing it, we will slowly adapt, and over time we'll be able to tolerate more and more and more. It's almost like a graded exposure. If someone had a phobia with spiders, part of the process or a cognitive behavioral approach would be maybe the therapist would just start out by showing them a picture of a spider, and then over the next couple weeks they may bring a spider across the room in a box, and then over the next couple weeks they may take the spider out of the box across the room, and over time the response would be to let the spider come closer and closer and closer without getting that fear response. And that's what exercise is. We slowly introduce exercise and allow the body to adapt and accommodate. And then we push it a little more and a little more and a little more. Understanding these concepts, hurt does not equal harm. We're safe, but we're sore. Going into pain a little bit, but not causing an extreme flare-up. And that's how the body adapts, and that's how we progress to our ultimate goal of sitting longer, standing longer, jogging further. If we only follow the mantra, if it hurts, I won't do it, you will not be able to do much because, as we said, you may not be able to even walk 200 feet without causing pain, or you may not be able to bend at all. So you're not going to be able to garden at all. And you kind of paint yourself into a corner because you're afraid to trigger the pain because you're afraid something may be damaged. Well, you're never going to adapt to that. And again, that's the equivalent of if your goal is to not be afraid of spiders and the therapy only consisted of you looking at spiders across the room instead of slowly introducing the spider to you. If you always stay below the pain level, you're never going to adapt to that pain, and actually over time you'll be able to do less and less because you'll be avoiding the pain more and more. So we have to poke into the pain a little bit, introduce you to that pain, and then reprogram your body's response to that pain, and the brain's rewiring that whole responsiveness to that pain pathway. On the other hand, we have patients who have been in chronic pain. They don't pay attention at all to the pain. They go right through the pain. As soon as the nerves start firing, they say, you know what, I'm going to deal with it later. I'm going to finish this gardening. I'm going to clean the house for 2 hours. And then they flare themselves up, and then they're in this vicious cycle of extreme pain and flare-ups back down to their baseline pain. Or they start an exercise regimen and they run for maybe 5 minutes, and they say, you know what, I feel pain, my knee hurts, but I'm going to run for 5 miles. This isn't good either. So as you can see, the two extremes are not exercising in pain at all and just blowing through pain, doing way too much, causing a flare-up, and then going back to your pain. Neither one of these strategies is going to get you to the ultimate goal of turning down the sensitivity in those pain alarm bells. So there's different guidelines that we give to patients, or we instruct patients on, regarding exercising and movement through pain. So if we look here, we want to go a little bit into the pain, trigger a little bit of firing of those nerves and receptors, but again, not get into that high risk category where we risk a significant flare up, where we can't get out of bed, we need to take more medication, or we risk injury, which is totally counterproductive and will just feed into this pain cycle. So we kind of use a stoplight analogy. All the way to the left, from 0 to 2, this is out of 10. So 0 being no pain, 10 being the worst pain. We want to stay between a 3 to 5. So that's right in the yellow area where we're feeling pain, it's not getting significantly worse, and then we monitor how it feels the next 24 hours. We may feel a little sore, but we don't have that flare up. We don't have to take more medication. We don't lose whatever function we have. We could still sit for the same amount of time, stand the same amount of time, but we're not significantly worse. On the other hand, the green is we're safe, we feel a little pain, and maybe the pain gets better as we go. That's great, but we don't always just want to stay there in the comfortable level of feeling no discomfort, because again, we won't adapt. So there has to be a balance. And that is where the guidance of a rehabilitation specialist comes in to guide you through, because in a chronic pain patient, most of the time this can't be done alone, because you'll either not be doing enough or you'll be doing way too much. So the exercise is our medicine. Just like a doctor would prescribe you a certain dose of medication and over time monitor that dose, movement and exercise is our prescription. And we're monitoring the dose carefully to make sure you're getting the benefit and the effect.